Hi, it's Tracy from the Secretariat, and I'm here with Professor Micheal Nicholas, who is one of our guest presenters at our annual scientific meeting down in Hobart. Thanks for joining us, Micheal. I was just wondering, what's the basic take-home message you would like our delegates to get from this conference?
Well, I think the key thing from our research in the last couple of years is that although we don't have miracle cures, if we could get our patients to adhere more closely to our treatment plans, we would get much better results than we're getting now. And this means we need to start thinking about ways of improving adherence rather than just thinking about what new treatments are out there. I think we should try to use the ones we've got, as imperfect as they are, but to try to use them more effectively. And a key way to do that is to help patients actually apply themselves to these methods and to sustain that application.
Does this feed into our theme of pain self-management?
Oh, exactly. Because when chronic pain becomes chronic, it's going to last a long time, and no one can honestly tell you how long you're going to have it or when or if it will go away. So in the meantime, people tell you you've got to learn to live with it, but they don't often tell you how to do that, and that's what you need to learn. But we can, in the pain community, can help teach people how to do that. But this does require skills. And this is the second aspect of my message. So the first message is let's try to improve adherence. And the second thing is how. And that is by looking at our skills as clinicians. We haven't paid enough attention to this area in my view. And I think we could do better. And so we've developed some training programs for health professionals through webinars online. It can be done from anywhere in the country over a period of weeks to learn the skills required to improve adherence. And I think without any new discoveries, if we could combine the training with the application, we would get much better results.
So do you feel we've got to go back to the coalface and start this training at primary care level?
Yes, I think this starts from as soon as someone comes in with pain and they've got to go away and manage it, whether that's in the form of taking tablets or doing exercises or a range of things. It all comes down to their application. You can have the best treatment in the world, but if people don't use it, it's not going to have any effect. So we've got to pay attention to that basic element of helping patients work out how to do it. And it's not that they don't want to do it or don't think it's a good idea, but often treatments involve changing the way you do things. And we all know it's very hard to change old habits, old ways of living. But that's what we have to think about if we are to get people to self-manage their pain.
And of course, you're contributing to our allied health professionals and all our health professionals here, and also with the Consumer Forum, you'll be making a contribution and presentation for them as well.
Exactly, and it applies to everyone. It doesn't matter which profession or whether you're a consumer or not. These issues are fundamental. It's important that the community understand pain or chronic pain better and realise that medicine and surgery have limits. It's hard to believe in this day and age, I guess, that there are limits, but that is the reality. And it would be wrong for us to keep suggesting we've got all the answers. However, we can do better and get better results if we use the treatments more effectively and help our patients make changes to their lifestyle that will help them to manage their pain over the long term. And that's our challenge.
Thank you, Micheal. I hope you get to enjoy Hobart a little bit also while you're down with us.
I hope so too.
Take care. Bye-bye.